Hi guys, Kane Harrison here. Welcome to PAI Medical, WeGrowHair.com Medical Minute. I'm joined by Clinic Director Michael Ramsey. Good morning, mate.
Good morning, sir.
It's great to have you back.
It's great to be back.
We're going to discuss a bunch of different things, but what I want to talk about specifically, something that I didn't even know happened, is beard transplants. Let's talk about that.
Yeah, it's an odd thing. A decade ago, 10 years ago, we decided to offer beard transplants for patients because we were getting a few calls, a few a year, not many. But we thought, well, let's do it because it's basically the same technology as a hair transplant to the head. So you fast forward 10 years, CNN called 8 months ago wanting to do a story on beard transplants because we've been doing it for so long. And essentially what's happened is this convergence of style and fashion where this hipster generation where men will wear a scruffy beard. It's like you have a nice even beard, right? And then you've got the Duck Dynasty thing where people just random full beards. And then you got guys that can't grow beards that want to kind of blend in or fit in and whatnot. And then you have this other convergence where the Middle Eastern influences, Middle Eastern men have beards because it's a masculine trait. It's one of their cultural things that you just do if you can. And so all these people are suddenly flocking into the center, and we have 3, 4, 5 calls a week. Mm-hmm. Patients wanting to do beard transplants. So the basic way it works is we harvest hairs from the sides and the back in most cases, and we fill in little gaps where they have gaps, or if they have no hair, we can put the hairs closer together and blend it into the hair they have. The common question is, well, is the hair like beard hair?
Right.
The answer is it's not exactly like, but you can't tell. Okay. Now microscopically, if you look at two different hairs, one that we put here from the back and a beard hair, there's a slight different texture. But you can't really tell.
So, I mean, we've had many conversations about hair transplants before. We've never talked about beard transplants, so I'm finding this incredibly interesting. But from memory, and correct me if I'm wrong, you can take the hair from here and put it here, but you don't take the hair from here and put it here.
Well, you don't normally.
Right.
It's done. We don't do it. There are a few clinics in the U.S. that will take some beard hair and they'll move it to the scalp.
Right.
Or let's say if a guy has thick chest hair or hair on the back or wherever, you can in fact harvest those hairs.
But it's generally because of the texture that you wouldn't do that.
You wouldn't do that, and here's another problem. Hair on the head and the beard grows quickly. Mm-hmm. In other words, you could grow a beard probably in a week or two and it'd be longer, right? Your leg hair only grows a certain length, right? So, or chest hair. Mm-hmm. So when we start taking chest or body hair as it's called and moving it to the beard or the head, it grows so slowly. Mm-hmm. It may take a decade to grow 2, 3, 4 inches. And so that's a problem. So patients that have a hair loss problem, they want that hair sometime this decade, mm-hmm. to fill in. So we don't typically use body hair to do beards or the scalp. In fact, we'll take scalp hair to do the beard. And we can take beard hair and do the scalp, but we don't usually take beard hair to do the scalp.
Now, I mean, as I said, I think that this is incredibly fascinating, but I was looking at it from a vanity standpoint, and when you went into cultural differences as well, mm-hmm. Middle Eastern men, but also some people who've had scarring.
Very good point. So I would say 10% of the people that call us about beard transplants have a scar on their face they want to hide, or some acne scars. Mm-hmm. In fact, I talked to a patient yesterday. He has a little bit of acne scarring on one side, a little bit on the other. So he's going to come in August, and we're going to go in and fill in those little scars for him. And you can see the scars on his face for 2 reasons. Number one, the skin is lighter in color, so there's no melanin. But more importantly, he doesn't have any hair there to sort of blend it. So what we're going to do is go in and add hair to the scarring areas. And we understand that not all hair is going to survive in a scar. Mm-hmm. That's just the way it is. So if we put 10 hairs in a little scar area and only 8 grow, it's not perfect, but it's 8 more than he had, and mm-hmm. it helps blend the beard in. So if he wants to grow a beard, he can. Or if he just wants more of an even distribution of the hair to help kind of conceal the scar somewhat, it helps with that.
I think it's fantastic. Of course, if you guys want any more information on beard transplants or any other transplants, of course, PAI Medical, WeGrowHair.com are just the people to talk to. And Michael, of course, they can find you at WeGrowHair.com.
WeGrowHair.com.
And thank you guys again for joining us for PAI Medical Minute. Don't forget to check out WeGrowHair.com and go in and see Michael and his fantastic staff here in Brentwood. And we'll see you next time on the Medical Minute.